My name is Anaja Jones. I am a senior here at Wilmington University, and I'm just going to be talking about how COVID-19 affected us, the United States, the entire world, and how we're just not ready for a pandemic. So this is just an introduction. Obviously, we all know what COVID is. COVID has claimed the lives of millions of people and destroyed properties, destroyed businesses, economic foundations, the business world. It affected the entire world, not just certain states or certain countries. Some were more devastating than others, but we were all still affected. This changed how people, lived, how we thought, how we think, how we responded to certain things. And just a significant amount of information that we just were not ready for and that we lacked. How are we prepared? We are not prepared. We, as the government and United States, we like to invest less in global cooperation for the prevention and control of pandemics. Also, the number of diseases per decade has increased nearly fourfold over the past 60 years. And since 1980, the number of outbreaks per year has more than tripled. We always we fail to identify the root of the history because we never really go into enough research. I feel like it says on the PowerPoint, the failures are rooted in the history of inequity and inaction. Another thing is, even after COVID, or after having COVID for 20 months, we are still not prepared because we were still sitting here trying to figure out how we're going to deal with the strands that we actually got from COVID, and how the capacity to end the current pandemic in the near future, or to even prevent the next one. So with that, we are obviously not prepared. Inadequate preparation in the United States, we were not prepared. I feel like nobody really took it seriously until it started becoming more of a trend. We don't take things seriously until it becomes a trend, to where a trend of people were dying, or the amount of increase of health issues that was going on. Public health authorities and even the U.S. political higher ups, they didn't take the preparation seriously for the pandemic. This didn't allow us, this technically challenged political authorities and various public health authorities, because we never really knew about the novelty of the pathogen. A period of uncertainty about the details of the coronavirus was not given to the community or around the whole entire world, so we were very ill prepared for it. And then we all know the effects of COVID-19, as you can see in a little chart, about just the number-wise of the effects. But obviously, loss of employment, a lot of people lost their jobs, such as restaurants, because it was not a work-from-home guaranteed. This was automatic shutdown, interruption of our normal social life. We weren't allowed to be around people. And if we were, we had to stay 6 feet apart. We had to wear a mask. We had to, just sanitize. Definitely the interruption of educational programs for every student, every kid, but more so it affected high school seniors and college seniors because they didn't get a chance to, walk on the stage with their friends and family, have a normal graduation, especially with high school, with prom and senior pictures and just all the senior activities that the high schools had going on. This really affected them, and I know a lot of them were very, very, very devastated. And then how to maintain a good resilience and mental health during COVID-19. There have been lots of articles and just things to help with COVID-19 and us being quarantined all day, every day, not leaving the house. So WebMD, Google, CDC, even social media influencers have obviously, put some of their helpful tips out, such as staying, socially connected, meaning social media, have FaceTime, group movies or whatever, individual routines, and definitely self-care. This was one of the main things that I do think COVID did actually have an impact on in a good, positive way, because a lot of people who are always on the go, who never really have time to take care of themselves, to breathe, they had all the time in the world because we were obviously on lockdown. Which is not a bad thing, actually. Reasons for the pandemic preparation: obviously to assess the threat, get to know the threat, understand the threat, and which would lead to an early preparation for not just the CDC or the government, just the United States or all of America or the other countries. Because with us knowing and y'all giving us the information up front, what we need to do, how we need to do it, what we need to fix, this helps with the prevention of severe impacts, such as how COVID got so out of hand. Alright, and then the role of our government was really all over the place. Nobody was really in effect with each other, because I know certain states had their mayors had different viewpoints, what was going on, and they, did different laws and stuff like that. So I know in Atlanta, where I currently live here, we weren't really strict on masks. So it was, so like some places downtown, you were able to not wear a mask. You were able to wear one if you really wanted to, but you didn't have to. Certain places obviously did require you to wear a mask, or you could not enter. One of the articles that I read in my research by McCloskey suggests that the reports that states and countries need to build a system of trust and how to go about working together to help recognize and handle a possible pandemic, which is true. I feel like we all need to be on the same page, not just trying to do what's best for one state or whatever. We all need to be on the same page. Now, with that being said, this brings me to the next one, which is strategies of mitigating the pandemic. This basically suggests just vaccinations, improve healthcare systems and technologies, timely policy responses, meaning that crisis management to mitigate the spread of the coronavirus and other similar epidemics, which is established by national authorities, urban and regional bodies. The article that I was reading that goes along with this PowerPoint, it discusses the organizations partner with other corporations to design effective policy responses to enhance health and safety in communities, and just how the vaccines work, and basically just through a thorough research, which we did not get at the beginning of the pandemic. So, with the improved healthcare systems and technologies, this brings me to the next slide, which is the healthcare policies during COVID-19. So, each hospital had their own policies set up for their nurses and doctors, which is a good thing because they are people too. They have families, they have kids. They had groups or programs that make the psychological and PPE support available for every healthcare workers during the pandemic. This is generating a single official platform to update staff on updated clinical regulations. And then basically it was just a more organized healthcare situation that helped the staff continue to be updated and conscious about it. This was a really good one, only because my aunt or my sister-in-law, she works for the hospital, so this was very big for us. Workplace policies during COVID-19. Obviously, a lot of people were affected. They didn't have jobs anymore. Places shut down, especially small businesses. But the surge in remote work has went up tremendously. But if you didn't work from home, if that wasn't available to you, you still had to go into the office. You had to maintain social distancing. Obviously, you had to basically sanitize everything before and after and during you being in the office. Use of face mask, hand washing, obviously. And then they still held virtual meetings, which is, not that big of a deal, obviously. And then organizations in response to COVID-19. We're going to start off with the World Bank. They basically focused on helping nations address the transition and crisis to recovery through protecting the poor, saving lives, strengthening institutions and policies, and securing the foundations of the nation's economy. And the USAID aimed to end the pandemic and keep Americans safe, which means rebuild the global and U.S. economies and save lives worldwide. Basically, and they helped about 120 nations to combat and contain the virus. And COVID-19 response addressed the pillars and sections covered in WHO's, which is the World Health Organization response, and strategic preparedness plan. And then for future considerations, obviously, health organizations and government should adjust preparatory measures, meaning they should have maybe monthly meetings about it, or maybe not monthly, but maybe once every 2 to 3 months, just to talk about what can happen, what's going to go on. Flexible social and public measures, need for global and regional collective response. This means getting together and responding to the pandemic, how that particular region or that state are reacting to it, and the response of it, and getting together to find an ultimate plan. The incorporation of universal healthcare, basically meaning that when it does come down to a pandemic, whether it's this one or if we do have a next pandemic, God forbid we don't, but if we do have another pandemic, that each healthcare system and hospital are in place, and we know what needs to happen, what needs to go on throughout the world. And then investment on medical research and development. This is a big one. This is a heavy one, because I just feel as though we need more research on the vaccines, especially with the way how they handle vaccines for COVID this year. They need to do heavy medical research. They need to do research on COVID-19 still, and not just on the new strands that we found, especially the newest one, the Delta Omicron. We need to test everything, figure out everything, and just basically understand, instead of just telling the country and the United States what we need to do. And then these are just my references, and I hope you guys have a great rest of your semester. Thank you.